Hi everyone, Suneel Dhand, medical doctor. Welcome to another video. I want to go over a report which has been released by the White House regarding the health of President Donald Trump. And I found this very interesting indeed, and I'm going to go over it with you line by line, because a couple of weeks ago I made a video, many of you saw this, regarding President Trump's dramatic weight loss over the last few months. Very impressive indeed, as far as I'm concerned, and hopefully has resulted in some improvements to baseline metabolic health. And I'm going to share it with you here. I have it pulled up on my computer screen and on the iPad. And here it is right here. So as you can see, it's titled Memorandum from the White House Physician. So I'm going to go through this with you here. There's a section at the top, which is addressed to Caroline Leavitt, the White House press secretary. And it is from Captain Sean Barbarella. That's a great name, who is President Trump's personal physician. So let's go through this. It talks about the annual physical for the president from April the 11th, 2025. And the first thing that I would like to say, and this is going back decades, regardless of president, the United States White House physician will almost never produce a report suggesting that the president is in anything other than excellent health. This goes back a very long time, regardless of the president. You can even look at the last president, President Biden. But they will submit some baseline figures. And the best thing to do, especially if one is in medicine and healthcare, is to use one's own judgment. But I would say the general public has a good instinct. I mean, everybody has an instinct when they look at someone. You can often tell whether somebody is physically in good shape and if somebody is mentally intact as well by their behavior on camera. So that's the first thing I would like to say, being completely impartial, is that you will never see a White House doctor submit a report of poor health or suggesting any deficiencies. And this goes back to the United States never wanting to project an image of weakness to her adversaries, particularly overseas. So that will rarely happen. But let's look into the figures nevertheless. Some vital statistics here. Age 78 years and 10 months. It's worth remembering that President Donald Trump, although he may look very vigorous and work like somebody who's 40 years younger, he is nevertheless 78 years and 10 months, which makes him one of the oldest presidents in office. His height is 75 inches. So what is that? Just over 6 foot, actually 6'3". That's a good height. His weight is 224 pounds. So let's calculate his BMI here. So here we go, 6'3" and 224 pounds. So that comes to a BMI of 28, which puts him in an overweight category. Now, anybody can go online and calculate their body mass index. It's usually accurate most of the time. In some people who have a lot of muscular mass, which is the minority of the population, it can be artificially elevated, or people who have a high bone density. But President Trump is in the overweight category. That's a BMI of between 25 to 30. More than 30 is obese. So previously, he would have been obese. He's now in the overweight category, which is an improvement in terms of a baseline important number there. His resting heart rate, 62 beats per minute. That's a good, healthy resting heart rate. It's actually on the lower side. A lot of people's resting heart rates is between 70 to 80. But the lower, the better. Obviously, you don't want it to be too low, like in the low 50s or 40s. That can start to cause problems, but 62 beats a minute is good. His blood pressure is 128/74. Now, those of you who follow me know that I'm never a fan of an arbitrary cutoff for any number, but generally 120/80 is considered the ideal blood pressure. So that's a good blood pressure, and he's not on any blood pressure medicines. I will come to that in a moment. His pulse oximetry is 99% on room air. That's excellent. And his temperature, 98.6. He's not got any fevers. You wouldn't expect that. Then it goes through some different components of the examination, including eyes, head, ears, nose, throat, neck, pulmonary system. It all seems to be fairly normal. It does note here, interestingly, scarring on his right ear from a gunshot wound. We all know what happened last year and the near tragedy that occurred. Then goes through his cardiac examination, revealing a regular rate and rhythm. He's in normal sinus rhythm. So unlike a lot of people his age, he's not in atrial fibrillation, which I'm sure you've all heard of before. You probably know someone with atrial fibrillation. 10 to 20% of the population of his age group has the condition. So normal sinus rhythm. His abdominal examination is normal. They did do an ultrasound on him, and they noted that a colonoscopy in July 2024, so not even a year ago, revealed diverticulosis and a benign polyp. Very common to find diverticulosis Those are muscular outpouchings of the bowel wall, and they tend to occur more in Western countries where people have low fiber diets in general. If you look at a map of the world, countries with low rates of diverticulosis, which then can go on and become inflamed, to diverticulitis, generally the countries with higher fiber intake have a lower rate of diverticulosis. So not a surprise that he has that, like many people, many Americans or Brits of his age group. Gastroenterology recommended a follow-up colonoscopy in 3 years because of a benign polyp. I will have to make a whole other video sometime about my thoughts on screening colonoscopies and how they are used, I believe, as a money-making machine in many Western countries. Now, obviously, you have to weigh up risk. And the sad thing is that because of the toxic Western diet, many people are developing bowel issues earlier and earlier in life. So obviously everybody has to weigh up their own risks, benefits, family history, etc. But screening colonoscopies are used in the United States way more than many other countries. Many countries, in fact, the vast majority of countries don't even do screening colonoscopies. They may screen for colon cancer in other ways, but not with colonoscopies. Okay, let's go next. His GU system, urinary system, no abnormalities noted. Extremities, musculoskeletal. His muscles had a good range of motion. Neurological examination. This is interesting. They did a full cranial nerve examination on him. That's predominantly an examination on the eyes, face. You examine the mouth. They are what's known as the 12 cranial nerves. So that was noted to be within normal limits. Then they did a cognitive assessment on him, called the Montreal Cognitive Assessment, and he scored 30 out of 30. So a perfect result there. Then they did a questionnaire for general health and generalized anxiety disorder. I think you would be hard pressed to find somebody in politics, especially a president, who doesn't have some stress and anxiety. It's a very stressful job, but the scores were normal and they screened for depression. President Trump doesn't seem like the type to get depressed. So that was normal, not a surprise there, as far as I'm concerned. Then they did a skin examination and they found some minor sun damage and a few benign lesions, very common in the Caucasian population especially. Then they went over his lab results here. This is interesting. So his lipid panel, his cholesterol panel, total cholesterol was 140. The optimal is less than 200. Triglycerides, 56. The HDL, what we call the good cholesterol, was 77, which is actually very good. Above 50 is really good. And the LDL bad cholesterol was 51, the low density cholesterol. I'll come more to that in a moment. It's actually on the lower side. So his doctors are being very aggressive with cholesterol management. Then we had the complete blood count, which was within normal range. The white blood cells, 4.4, hemoglobin, 14.5. His platelet count was also normal. Platelets are involved in blood clotting. Then we had the metabolic panel on him. So they put some key markers here, including the creatinine kidney function, 0.89 within normal limits. Remember, those of you watching overseas in the UK and Europe, the numbers are different that you use over there, but this creatinine is normal. His liver function, ALT, AST, 41 and 28 respectively, so within normal limits. A lot of the population now, I see this all the time, especially those who are overweight or obese, have fatty liver disease, fatty deposits in the liver, which result in abnormal liver function tests. Normal here on President Trump. They test for a B12 vitamin, which is within normal range. TSH, thyroid function, also within normal range at 1.42. And his glucose is 89.7. And then they did a HbA1c, which is 5.2. So according to that, President Trump doesn't have prediabetes. I really would have liked to have seen some other tests, including a fasting insulin level, to enable me to calculate a HOMA-IR. I suspect that President Trump, like most of the population, is insulin resistant, but the medical establishment, for some strange reason, doesn't test fasting insulin levels. If you want to watch any of my videos on how to calculate the HOMA-IR for insulin resistance, then I've made many of those, and I can include one in the links down below. Okay, then we have a urinalysis, which was normal, so no blood in his urine. That's often something which is looked for in anybody of his age. They noted his past medical history, which is significant for well-controlled high cholesterol. So well-controlled hypercholesterolemia. He has seasonal allergies. I mean, who doesn't? He does have a history of the pandemic infection, like most people do. And he did have a case back in 2020. We all remember that. He has well-managed rosacea, which is an inflammatory skin disorder. And then they note some other benign skin lesions. Diverticulosis is mentioned again, as is a benign colon polyp. Past surgical history here. He had his appendix out when he was 11. Bilateral cataract surgery. I didn't know that he had that, but they've noted that here. His social history. This is absolute key. He is basically a lifelong non-smoker, and he does not touch alcohol for decades. So that is absolutely fantastic. How many people can say that? He did actually, if I remember correctly, have a very negative experience with a family member. I think it was his brother who was an alcoholic, and that put him off alcohol for life. Okay, current medications. This is the interesting part. So we have rosuvastatin, which is a statin medication, also known as Crestor. He's on ezetimibe, also known as Zetia. He's on aspirin for cardiac prevention, and he's on mometasone cream as needed, which is a steroid cream for a skin condition. Lots of people take those types of creams as needed. But I really want to focus on the management of his cholesterol. Now, I've talked extensively about this before as well. I'll include some of my video links, but I do take issue with the lipid cholesterol hypothesis and the huge push. And we all know that the statin industry is worth billions and billions of dollars. And I believe that we are way too aggressive with statin management. When you actually look at the studies, when you actually follow the science, who would have thought? But sadly, most doctors right now, if you actually ask them to quote any statin studies, they won't be able to quote them off the top of their head. And they won't really understand that when you dive into the true benefits in terms of how much statins improve life expectancy and reduce risk of cardiac events and even strokes, it's nowhere near what you may expect. That is data from the pharmaceutical companies. But of course, statistical games are often played to make medicines seem better than they are. And when you focus on a number as opposed to an outcome, that's also a deficiency in logic as well. So President Trump's cholesterol here, his LDL cholesterol, is being aggressively managed at 51. And what I hope, and I would think that President Trump has good doctors, I hope that they really look into the research on aggressively treating cholesterol, especially in an older age group, and problems that can occur. I mean, we all know the brain, or you may not know this, but I've quoted this in many videos. The brain is 60% fat, and there's a fair body of research, as would be expected, that when you're hyper aggressive with something, I mean, this could apply to blood pressure and even blood sugar control, you can get detrimental effects. And there's research out there on a link with cognitive decline in people who are on cholesterol medications, and the LDL cholesterol is really aggressively managed. And his LDL cholesterol, while some doctors may think it's a great thing to be on two cholesterol medications here, the rosuvastatin and the ezetimibe, I would urge a bit more thought put into that. I mean, maybe there's another reason why they're being very aggressive here with his cholesterol management. But that cholesterol number 51, I think, is on the lower side that we would usually see. And some doctors might really celebrate, oh yes, we fixed a number, we've got a number as low as possible. But invariably, and I've seen many situations like this with many different conditions, when you become hyper aggressive, it can lead to not so good effects in the long term. So that would be what I would be keeping close watch on if I was President Trump's doctor, whether he really needs those two cholesterol medications. It doesn't state what the doses are here. The aspirin for cardiac prevention, I mean, fairly common. Data is kind of back and forth on this. I usually think it's an okay idea to be on aspirin if you have some cardiac risk factors or you have a family history. A lot of people take it every other day instead of every day. A baby aspirin in the United States, it's 81 milligrams. In the United Kingdom, it's 75 milligrams. And I prefer it to be enteric coated. Okay, it then goes over President Trump's immunizations, and they say that all his jabs are current, including travel-related immunizations. So he's had all of his quote-unquote shots. So in summary, President Trump remains in excellent health, exhibiting robust cardiac, pulmonary, neurological, and general physical function. His active lifestyle continues to contribute significantly to his well-being. President Trump's days include participation in multiple meetings, public appearances, press availability, and frequent victories in golf events. President Trump exhibits excellent cognitive and physical health and is fully fit to execute the duties of the commander-in-chief and head of state. So again, you will never, ever see a report from a White House doctor which says anything different than the President of the United States being in great health. And there's a strategic reason for that. As I said, the United States will never want to project that its leader is anything other than robust. But it's up to each one of us, and fair enough, people within the medical profession, to go through this and give their own thoughts. I mean, I've given mine. Perhaps some other doctors have different opinions. But in summary, then, I would say that looking at President Trump, 78 years old, so touching 80, obviously doing a job like this is high stress. And when you look at him on a daily basis, working and working, how he's walking around, his recent weight loss as well, that is damn impressive. Not many people of his age could do that. And in terms of his history here and the fact that he is 78, I would advise his doctors, or at least give my own opinion, that his cholesterol management should be looked at here, whether we want to be highly aggressive, as appears to be the case with 2 cholesterol medications. What is the evidence that his particular LDL cholesterol number of 51 brings long-term benefits? And what is the evidence? Because there is some research out there that it's not such a good thing. The aspirin for cardiac prevention is fair enough, and the steroid cream is also something which is commonly used for inflammatory skin conditions. I personally would urge President Trump to still focus on his metabolic health, his weight loss. If he could get that body mass index closer to 25, I mean, it may not be realistic, or maybe he won't look good if his BMI drops under 25, but keep focusing on more weight loss. His waist size, I'm sure, is still larger than ideal, shall we put it that way? And with each passing year, just be a bit more careful with stress. A body of 78 is a body of 78. He's not 21 anymore. So please be careful. Make sure that you're managing your stress. I'm sure playing golf helps. Keep up that moderate intensity activity. And although it is well known that President Trump doesn't like to sleep very much, he sleeps only 4 or 5 hours, this may start to affect him more as he gets older. It is in the interest of any country and its citizens to have a leader who is in good physical and mental health. So that's what I would say about this. Thank you everyone for watching. Feel free to leave a comment down below. Let me know what you think. Do check the links in the description down below for all the other work I do, my website, my free newsletter. If you're not already signed up for that, please do so. And our natural supplement store, my uniquely formulated natural supplements. All those links are down below. Hit the like button if you like this video, the subscribe button for more similar videos in the future, and do share with anyone else who you think may enjoy watching. We will speak again in the next video.